and we are going to begin a lecture series on senior dental care. Now this lecture series I am going to divide into 5 parts where I am going to talk about various aspects of senior dental care. Today's lecture is going to be about what is the importance of senior dental care and what is the effect of aging on the oral health of older adults. Senior dental care is also known as geriatric dentistry. Geriatric dentistry mainly involves the delivery of dental care to older adults, which involves the diagnosis, prevention and treatment of oral problems which are associated with normal aging and age-related oral diseases and their treatments. Now, the government of India has classified people as above 60 years as elders, whereas in other countries like US, UK, etc., this age limit is around 65 years. Now, as per statistics, currently there are around 600 million people all over the world who are above 60 years of age, and this figure is considered to be doubled in another 5 years or so. Even in India, it is estimated that there are around 75 million people who are above 60 years of age, and one study has estimated that this figure will increase to around 200 million in another decade or so. Thus, the population of elders is exponentially growing, and that is why their general and oral health problems need to be taken care of. Now, geriatric medicine, or taking care of the general health or medical aspects of the elderly, is now become a well-established branch in India since last 2 decades. But little attention is being paid to the oral care of the seniors. Not only they themselves are neglecting their oral health, but also their nurses and caregivers as well. That is why this lecture series is dedicated not just to the elder patients, but also to their caregivers, nurses, geriatric physicians, social workers and even dentists as well. Nowadays, it is very common that most of the elders are retaining their teeth. So it is presenting a challenge for oral care and professional care of maintaining the dentition for a whole lifetime. Now, if the lifespan of the elders is increasing, it is very important to maintain the dentition, whether it is a natural dentition or it is an artificial dentition. But it is important not only for the general health of the elder person, but also for them to have a good quality of life. Now, maintenance of this dentition requires the knowledge of not just the medical and dental aspects of aging, but there are many other issues about ambulation, or whether the elder person is living independently or whether the elder person is dependent person, whether he or she they are staying in old age homes or they are staying with their own family, how much the older person is social, what kind of sensory functions of the elder person or motor functions are working. So all these, there are many biological, psychological, emotional, social, lot of considerations have to be done. That is why the senior person and their family have to understand that the dentist, when he or she is planning the dental treatment, there has to be an interdisciplinary team. A lot of medical and dental practitioners together will formulate the dental treatment plan of the elderly. Now, have come to know why senior dental care is important. Now, I will be talking about what are treatments, what are the common problems, and what are the treatments that need to be done for these senior patients. But right now, I would like to give all of you an idea as to how aging is affecting the oral health of the elderly, or how oral health gets degraded faster in the elderly patients. Now, various organs in the mouth are getting affected because of the natural aging process. The bone, the soft tissue, the teeth, the jaw joint, everything. So speaking about bone, What happens is there is calcium deficiency is commonly seen in the elders. Because of this, there is bone loss, there is decrease in the density of bone. What happens in this case is the alveolar bone, or the part of the jawbone, upper jawbone and the lower jawbone, which is holding the teeth, it is the first affected because of this kind of bone loss. This makes the elderly susceptible to jaw fracture, loose and migrating teeth, and increase in teeth decay. Then teeth are also affected because of aging. The main problem with main difference between teeth and the other body parts is that the reparative or the regenerative capacity of the teeth is very limited. Once the tooth surface is worn off, it is worn off. It cannot be regrown back again. Or once the tooth is chipped or fractured, it cannot be regrown back again. And the nerves and the blood vessels in the pulp of the tooth, they also become very less active as the age increases. Now the next, and yes, another important, the teeth can get attrited or eroded because of continuous biting with the opposing teeth, or there is a lot of lifetime exposure to various kinds of acids. If the elderly person might have been eating disorders in the earlier ages, there might be regular vomiting. Because of it, there is continuous acid present in the mouth. If the person was having clenching habit, if the person was under a lot of stress due to their working or their lifestyle, so all these things can wear off the tooth surfaces and not only increase the chances of dental erosion, but increase the chances of dental decay as well. Now talking about the jaw joint, this is what you see is the TMJ, the temporomandibular joint or the jaw joint. It also undergoes some changes due to aging, the signs of which can be clicking, or inability to open the mouth wide enough, or deviation of the jaw while chewing, etc. Along with this, the soft tissue in the mouth also undergoes some changes. There is the dryness of mouth is seen. We will be talking about this a lot in detail later, but right now I am just telling what the changes are seen. The mouth becomes dry, the saliva production is reduced. Because of this, there is increased chances of developing ulcers and various kinds of oral infections like candidiasis, denture problems like denture stomatitis, etc. In our country specifically, a lot of elders are staying in the rural areas, and in these areas especially, elders have many habits like tobacco chewing, snuff, etc. So because of all these things, the oral problems are aggravating. They have come with things like severe attrition, erosion, and the worst problems are pre-malignant lesions and oral cancer. Oral cancer, which is a disease of the aged, is most common, one of the most common cancers seen in our country, and constitutes about 15 to 20% of the cancers that are taking place in India. So now you can understand what is the gravity of the situation, what are the oral effects that are seen because of aging, and why it is really important to take preventive and curative dental care of the elderly. So today I am signing off on this note, and we will definitely meet in the next lecture, where I am going to talk about what are the various most common dental problems seen in elderly and what are the treatments that need to be done. Thank you so much.